Thank you. It's kind of funny because I always follow Leah in all these presentations, and finally, I've got my day. So, now I'm feeling good. So other duties as required. I want to start out by asking, who's read this in some kind of job description that they've seen, that they've thought about applying for at some point, right? Raise your hand. We've all seen it.
It's the most important one.
Exactly. It's that piece that means your boss can tell you to do anything and task you with any other responsibility, regardless if you know about it, if you're competent, if you understand it, and regardless if you have 1,000 other things to do, right? So other duties is required, and I think we've all been talking about this week in these 2 days, is that this other duties as required happens a lot to the health center staff, particularly in rural areas. So today I'm bringing you an example from Mozambique and a distribution, the vaccine distribution system that we're supporting there. Instead of background, we have the things we all know, because we do know that the crisis in human resources for health is exacerbated at the last mile of supply chain management. And that last mile of that last leg of the supply chain, getting the vaccines and other medicines to the service delivery point where they are guaranteed that they are available for people who need them. And there's other duties as required happens often, so a healthcare worker doesn't have the time to actually provide that quality care that she or he actually wants to do. And a fundamental issue with all of this is the system in which the health worker is working. So a nurse is not isolated, and this, what kind of strikes me really importantly these 2 days, is what I'm talking about here has been it's like almost a repetition of what other people have said already. The systems thing came up in India, I believe, in your presentation, that she's not isolated. There's so many other factors that influence it. So when we talk about human resources for health, we can't just talk about human resources because there's other factors. If the transport's not available for the supply chain, if the policies aren't in place, if the scope of works aren't clear. So we want to broaden the conversation beyond just the health worker, but to the system as a whole. And so an example from the Mozambique supply chain, the vaccine supply chain, and I think we're all pretty, we understand this pretty well. It's typically, it follows the administrative tiers. So the vaccine will go from the national level to the province level to the district, and then the district is responsible for taking the vaccines and getting them to the health centers. What happens, though, is at the district level, the resources that are required to do this aren't there. There's no vehicle, there's no fuel, there's not per diem available, there's no person available because they're out escorting the governor, et cetera, all the issues we know about. And so what ends up happening, as we all know, the healthcare worker has to arrange a day away from the health center, arrange transport out of her back pocket to get public transport to get to the district to pick up the vaccines and then to come back. So what ends up happening is it becomes an ad hoc distribution system, disempowered healthcare workers who are filling out requisitions for vaccines they either don't get or don't get the enough quantity of, and the missed opportunities of care when this health worker is not in the health center itself. And so essentially that last mile health worker must become a jack of all trades and a master of none. It's that other duties that's required piled on top of her. So what we've done in Mozambique is a system change, essentially an informed push system with a dedicated logistician and transport loops. So this dedicated logistician is a government employee, and he's responsible for distribution of vaccines based on real-time consumption data. So he's following transport loops from the province level directly to the health center level, collecting data, ensuring the quality of that data, providing supportive supervision to the health workers, and providing preventive maintenance of care for the cold chain. And so what this has done is put the level of responsibility of distribution at the province level where the resources that are needed for that are more likely to be available. They're not always there, let's be honest, they're not always 100% there, but they're more likely to be available at the provincial level where distribution, it can become the hub for the distribution center. And so I think the benefits are usually best described when you compare the two systems, and there's a lot of information here, but essentially the key part that I want to focus on today is the personnel issue. And you can see in the government multi-tiered system there are 134 workers in this one province. This was a comparison of two provinces with about 100 healthcare centers in each. In the multi-tiered system where the government's following the administrative tiers, there are 134 workers that are required for any kind of logistics work. In the informed push model with using the transport loops and this dedicated personnel, the task is consolidated to 6 workers. So what that means is that you can focus your energy, focus specialization on these 6 people instead of diffusing it through the system to 134. And what that turns out to be in terms of time and time used for logistics is the difference between 348 staff days per month in the government system spent on logistics compared to 138 staff days per month in the informed push system. And essentially that more than 200 extra days falls entirely on the health worker, the woman who has to get up in the morning and have hundreds and hundreds of people waiting for her and then take a day off and find public transport to get to the district to pick up the vaccines just so she can do her job. So it's not really a great situation. So the informed push model that we're using streamlines the distribution, streamlines the responsibility factor, so you do have one person, the dedicated logistician, who can be responsible for the supply chain. And the benefits of this, and I wish it would say the benefits of an appropriate system. So it's not just any system, but the dedicated logistician in this particular situation, it's been applied to the Mozambique context. And it becomes a more efficient use of human resources. It creates opportunities for supply chain management specialization of these few dedicated personnel. And this is kind of a repeat of everything that we're saying. We all recognize that it's more efficient, more effective to have those dedicated people who are skilled and know their job and can focus on that area. And another key part is that the placement of this dedicated logistician matches the reality of the system and where those resources are actually available. And this, at the end, frees up health worker time to focus on patient care. So essentially the takeaway, the message from today is that every system needs to make those critical decisions to find efficiencies and find most effective ways to run their supply chain. In Mozambique, with this dedicated personnel and dedicated logistician, that was created to fit the context, to fit the available resources, and to fit the system design that's most appropriate for Mozambique. And I want to leave you just one final quote from a nurse in one of the provinces in Mozambique. And he said, "I'm more present in the health unit since this system started because I don't have to travel to the district to collect vaccines. I now have more time to do my job." And this, I think, is the essence of what we're trying to do here. We're trying to find efficiencies in the system. We're trying to ensure that health workers at the final distribution point that are dealing with the children and families, that they have the resources necessary, they've got the supplies, the commodities, and the skills to do their job. And with that, they can provide better quality of care and ensure healthier communities. Thank you.